I would like to welcome you all. I'm Serkan Güneş. I came from Hatay State Hospital and I'm a child and adolescent psychiatrist. I will be talking about signs of anxiety and approach to quality of life in ASD. As you all know, the autism spectrum disorder is a lifelong neurodevelopmental condition and which is characterized by actually lacking in social communication and repetitive behaviors. And apart from the disorder itself, there are other predispositions to other psychiatric disorders, and actually anxiety is included in the disorders. And in ASD, there are some coexistent anxiety findings, and there are studies about it. And around 50% of autistic children and adolescents have coexistent anxiety. And another study is from Gilbert and colleagues showed that anxiety is present in 50% of a sample of autistic 38-year-olds. In another study done in another population, aged population, showed that if there are some coexistent psychiatric disorders, the most common one is anxiety. So, in these anxiety disorders, which one of them are on the forefront? Well, social phobia, specific phobia, generalized anxiety disorder, separation anxiety disorder, and obsessive compulsive disorder are the most common ones. And the specific phobias are the most commonly seen one by 44% in anxiety disorders. So in ASD, the anxiety findings are seen. It gets complicated because in one of the core findings of ASD and anxiety can be overlapped, and for the clinician and for the parents it might be very hard to distinguish between them. So in a point of view of social anxiety, we can say that it's characterized principally by a fear of negative evaluation by others, and there is also an avoidance. And it can be mistaken as a social communication deficit seen commonly in ASD. And apart from this, as I mentioned earlier, multiple anxiety disorders can be seen concurrently, and recent studies show that there is growing evidence that some of the symptoms of the anxiety may manifest differently in autistic individuals. I think it's very significant. And in ASD and in anxiety, indications can be sleep problems and self-injuring behaviors, insistence on sameness, and under and over responsiveness in terms of sensory can be seen. But actually this is a very challenging situation for autistic people and for the parents of that children, especially for the evaluation process. Well, in the beginning I have mentioned that anxiety disorder is more commonly seen in ASD population. So why these anxiety disorders are more commonly seen in ASD? There are some studies about it regarding this, and in 2017, this is a study from Harrington, and it showed changes in the morphologic structure of brain. and especially in the amygdala, which is related to anxiety, there might be differences. And the studies showed that the right amygdala volume, when compared to the other two groups, actually there is a decrease. And especially when compared to the anxiety and the ASD people, the right amygdala volume is significantly decreased. And another thing to point out is in the ASD, the neurobiological responses may be altered. In the normal developmental people, when they feel agitated or when there's a stimulation, the symptoms of the body should be evaluated, and then the affective situation should be observed, and then we can do the interventions according to these findings. And monitoring the affective state is very significant. But autistic individuals, if they cannot experience the interoceptive cues, then they cannot monitor themselves sufficiently. Another mechanism is that, as you all know, in ASD, recognizing and understanding one's own emotions are very difficult, and then they can actually have difficulties in recognizing and understanding their anxietic feelings. Another mechanism in anxiety finding is that intolerance of uncertainty. This is one of the key mechanisms in relation to anxiety. The intolerance actually plays an important role of the findings in anxiety, and we can define it like this. If we have a tendency to react negatively on an emotional, cognitive, and behavioral level to uncertain situations and events. I mean, if this happens in a person with ASD and anxiety, this is on the forefront. This is one of the most important indications. This is a study from 2014 from Balter, and it suggests that IU may have a central role in the relationship between anxiety and ASD. As I mentioned earlier, in some ASD individuals, the clinical anxiety findings can differ. And in a study from Kern, they showed that the anxiety characteristics can be either typical or atypical. And the atypical ones are uncertain anxiety findings, and the sample was found to present, in the 70% of them were traditional symptoms, and in the 15% of them presented with ambiguous anxiety, and in the 31% of them showed a mixture of the two. Another study conducted in 2012 reported that the anxiety findings were divided into two: the shared anxiety characteristics and the ASD-specific anxiety processes. These are two groups, and the shared ones are generally typical samples, like negative social interactions and stimulations. But in the ASD-specific anxiety findings are not recognizing others' emotions and sensory sensitivities and negative social interactions, and actually being stubborn to be sameness. So, the atypicality of anxiety in ASD actually shows us that the standard anxiety scales can they be used or not, and there are studies regarding this. And we have a children's anxiety scale. It's evaluated, and in 3 studies it's indicated that they cannot actually include all of the findings of anxiety. And another study showed that the symptom inventory was evaluated, and it indicated that the anxiety indications for ASD is not included sufficiently. And can we actually develop new scales for anxiety in ASD? The Kern and colleagues actually have developed an autism addendum to the anxiety disorders schedule, and Rogers actually developed a new scale, and it's called Anxiety Scale for Children. But we need some ongoing studies about their validity. And while evaluating the indications for anxiety in ASD, there might be some misleadings, and that's why we need a holistic view from parents, from teachers, and from other caregivers. We need information from all of them. And when we see the anxiety indications, we should look for if there's an underlying cause or underlying disorder. We need to look for comorbid medical conditions. If there are some, then we need to treat them as soon as possible. For example, the sleep disturbances and self-injuring behaviors can be treated, and this can decrease anxiety findings. And we have 2 groups as psychosocial and behavioral interventions. And actually cognitive behavioral therapy can be effective in decreasing the indications of anxiety. A meta-analysis conducted in 2015 showed that the CBT can decrease the anxiety moderately, and the CBT actually can last for 1 and 2 hours, and between 6 and 32 sessions. Well, if you do exposure or psychotherapy, or if there is restructuring in terms of cognitive behaviors, it might be more effective. Well, we have some challenges in terms of application, especially for the compliance of the patient to that therapy. So we need to tailor the treatment in terms of the patient's skills, interests, and developmental capacity, as sometimes the parents can be added to that treatment process. And when it comes to pharmacological interventions, actually we have limited studies regarding pharmacological interventions. But in normal developmental individuals, we have some therapies, and it says that they can be used in the autism spectrum disorder. And for example, SSRIs can be used and can be effective in terms of aggression and irritability, it can increase the anxiety, so antipsychotic drugs can be opted. Benzodiazepine actually use has been popular, but it has some adverse events like drowsiness and irritability, so it's not recommended widely. In general, anxiety and ASD, what is recommended? Actually, low doses of SSRIs are recommended, but a frequent monitoring and interviews with parents are essential. This is the recommendation. Well, another point is the quality of life in ASD. Well, quality of life is a measure of an individual's well-being. And actually the environmental factors are included. There are various components, and the health-related quality of life is more about effects of a particular disorder. And for children and adolescents, developmental stages are also essential factors for their health-related quality of life. Well, even with early intensive behavioral interventions, in ASD, individuals are exposed to destructive effects in terms of physical and mental, and academic developmental stages are impaired. And actually, it impairs the quality of life. And in the individuals with ASD, psychosocial impairments such as social skills deficits and social competence problems affect the daily life, and they decrease the quality of life. Well, a minority of adults with autism, although continuing to be affected by autism, they can find work, and they can actually build really good relations, but actually the majority of them have a poor quality of life, and they need others' help. Well, most of the studies regarding this show that quality of life is relatively poor in people with ASD. And there's a meta-analysis conducted in 2015, and it indicates that in people with ASD, there's a comparison between the healthy people, and the quality of life differs significantly. In the adolescence age and in children and in the adulthood, there are some significant differences. Another study indicated that the parents actually evaluated the quality of life more poorly than the children themselves. They see their quality of life more negatively, and there are lots of reasons regarding this. One point is that they are very concerned about their children's quality of life. And another factor is that in ASD individuals, they cannot actually talk about their quality of life. They can be insufficient in terms of reporting their own quality of life, and they may have a deficit in self-representation that affects the identification, and they can perceive their limited social interactions in a different way. Well, to increase the quality of life, we need to know the factors associated with quality of life. The first one is the severity of autism. This is a study conducted by Camp Becker, and they reported that the autism affects the quality of life very poorly. And two studies suggested that autism severity was negatively associated with quality of life children in ASD. And another study conducted in 2013 showed that there's a negative relationship between autism severity and achievement dimensions of health-related quality of life. In a recent study conducted by us, indicated that the quality of life is related to the social and self-esteem domains of health-related quality of life. This is a negative relation. And one study reported behavior problems were negatively associated with quality of life. And aggressiveness and self-injuring behaviors, if they are treated, then it can have a positive effect on ASD. And the adaptive behavior actually positively increases the quality of life in children with ASD. Well, actually, adaptive behavior is defined as the skills needed for an individual to perform their daily activities, and actually it can be found with the specialized training. This is one of the key factors. Well, another study actually reported no association between quality of life and age, and this is very significant, I think. But on the contrary, Bennett's study reported that as the age increases, the quality of life decreases. Another review conducted in 2014 reported that the age was negatively associated with quality of life. Well, another factor is the intelligence. The intelligence is actually related to the quality of life. There are two studies, and actually it showed that there is no significant effect on quality of life, but the intelligence capacity is in the normal people in the study. But I think in the ASD the relationship would differ. Well, when it comes to gender, actually there was no relationship between gender and quality of life. And in terms of comorbid psychiatric conditions, when they were evaluated, if there is a comorbid psychiatric condition, it actually negatively affects the quality of life. Another study done in adults showed that leisure activities actually positively affect the quality of life. Well, to improve the quality of life, what do we do in ASD? As children with ASD grow older, well, they may experience different difficulties, and their interest can change. So, the adaptation process is a must. Well, to decrease the behavior problems, there might be interventions. As the behavioral problems are decreased, the quality of life can be better. And actually, competing and fighting with the social impairment is important because it affects negatively. So, the interventions related to the improvement of social impairments are very beneficial in terms of quality of life. And having adequate adaptive behavior is essential for ASD children and adults. And maybe educational services or institutions should be focusing on more about improvement. And if there are comorbid psychiatric conditions, the treatment is necessary. If they are treated, there might be an anxiety disorder or behavioral problems or ADHD. With the treatment, the children and adults with ASD, they can have a better quality of life. Well, to conclude, a higher quality of life is highly related to early diagnosis, and actually a support is needed from various areas. So that's why we need governments and institutions support in terms of ASD, because they can give and provide employment, and they can actually create different programs for them. Thank you for your patience.